So I'm going to talk about uninformed consent today. My name is Dorothy Mullen, and we've entitled this little video series, Dying Dar's Way, Radically Real Spiels on the End of Life. I have not been inside the medical system really for about 20 or 30 years because just about everything that was wrong with me in terms of my health didn't respond to conventional medicine, and so I did all of these alternative things or no medicine at all. And so I hadn't been exposed to this major shift to things being digital and just all of the changing rules inside the medical system. And I wasn't really exposed to what they call informed consent. I had a vague idea of what informed consent is or ought to be to protect the patient, make sure they understand what kind of care they're getting, that there's an agreement between the purveyors and the practitioners and the patients, but oh no, that's not what it is. What we really have is uninformed consent. We have documents that have been written with the benefits of attorneys present to work for the benefit of the system, the sellers, the testers, the agencies, the doctors, and the institutions. But since the patients and their loved ones have never read these forms and don't know a lot of the vocabulary, we're expected to sign off on all kinds of really important things that we know absolutely nothing about. I was asked to sign off that I was not going to have an allergic reaction to things I couldn't even pronounce. I was asked to say that I was willing to use a contrast, a metal called gadolinium, in order to do a PET scan. How am I supposed to know if I have an adverse reaction to something called gadolinium? I had never even heard of gadolinium before, so I didn't know if I could be informed about that. Nevertheless, you're in the office, expected to sign off on these things, and unless you're going to do a bunch of research on your cell phone right at the moment, how would you know what the consequences are of having these contrasts and so forth? So I started driving over to the radiology a day before I was going to get something, asked for the informed consent forms to take them home and study them beforehand. Of course, the people who work in these offices are surprised. They're surprised that I would want to read an informed consent form beforehand saying, the usual line is like, oh, nobody reads these, which I found sort of shocking. So I've had experiences where I was waiting for an hour in a waiting room, and then when I got into the phlebotomist's room, I was handed 8 of these forms, and I and 2 of my friends were with me, read all of them, and I refused to sign one of them, actually. That was a problem. I've been handed a little digital signing device that wasn't connected to a document. I had to ask, well, what does that attach to? And I've had experiences where there were potential very bad side effects that I was expected to sign off on. So I guess what I want people to know is that in our system, there isn't any such thing as informed consent. At least the way it works in my experience with stage 4 lung cancer is there's only you sign away on uninformed consent.